Hello, this presentation is about the effects of drug use during pregnancy and neonatal abstinence syndrome. Neonatal abstinence syndrome is another name for a group of symptoms that a baby may experience after withdrawing from prenatal drug exposure to narcotics, opiates, and other substances. The symptoms are as follows: restlessness, tremors, jitteriness, excessive sucking, seizures, sleep problems, poor feeding, poor weight gain, excessive yawning, rapid breathing, sweating, tight muscle tone, excessive crying that may be high-pitched or shrill, vomiting, sneezing or stuffy nose, diarrhea, and fever. Drug testing may be done on the baby by using cord blood, meconium, urine, nails, or hair from the baby. Drug tests may also be administered to the mother via a urine test. Factors of withdrawal. The severity of withdrawal depends on the type of the drug that was used, the amount that was used, how it was used, such as in pill form, shots, or liquid, the last time it was used before birth, the number of combined drugs, and whether the baby was full term or premature. The onset of withdrawal symptoms can vary from a few minutes after birth to weeks after birth. Some common drugs that are used during pregnancy are methadone, Subutex, Suboxone, marijuana, alcohol, heroin, cocaine, barbiturates, opiates, and antidepressants. Professionals will monitor a child after birth using a neonatal abstinence scoring system. One particular is called the modified Finnegan scoring system that is most commonly used. Non-pharmacological treatments or non-medicated treatments include swaddling, loose light clothes, skin-to-skin contact, slow rocking or swinging, low room temperature such as 68 to 75 degrees Fahrenheit, maintaining a quiet environment, using a pacifier for excessive sucking, changing diapers and clothes often to maintain clean and dry skin, feeding the baby on demand, and if the baby's hospitalized, visiting the baby frequently. Pharmacological or medicated treatments will be administered to the child after a certain amount of consecutive scores on the Finnegan scoring system. 2 consecutive scores greater than 12 and 3 consecutive scores greater than 8 will result in medication. Long-term outcomes for children exposed to drugs in utero include developmental delays, a high risk for drug dependency later on in life, attention deficit disorder, hyperactivity, difficulty transitioning between tasks, impulse control, sleep disorders, and sensory challenges. Recommendations for children exposed to drugs in utero: comprehensive counseling services, so a case manager that can support the family as a whole. Main families, which comes in the home, so there is no transportation needed, can also support the child. Child development services will support the developmental needs of the child and work with the family on delays. And education for practitioners, parents, and teachers and early interventionists is being implemented by the government right now to support everyone as a whole. Thank you.